Hello, in this video, I'm going to tell you all about post-concussion syndrome. So I'll start with what is it, then I will discuss the symptoms, risk factors, treatments available, and finally, toward the end, I will go over the pathophysiology of what is actually taking place in your brain during post-concussion syndrome. So first off, what is it? It is also referred to as persistent post-concussive symptoms. And it's a syndrome that might take place. It's when symptoms of a concussion last longer than expected. So it's something that could take place following a concussion. So when the normal course of treatment and the normal healing expectation for a concussion has taken place and symptoms persist beyond that, then you might have post-concussion syndrome. So risk of post-concussion syndrome is not related to the severity of the concussion itself. So regardless of how severe the concussion actually was, somebody might be equally likely to have post-concussion syndrome following that concussion. So this syndrome usually resolves within 3 months, but it can last for a year or even more. Symptoms can be present at rest, so somebody might experience these symptoms just all the time, or it might be unpredictable, or these symptoms might be brought on by too much physical or cognitive activity. So you might think you're completely fine at rest, but then you start thinking too much or doing too much physically, and it brings on those symptoms. Post-concussion syndrome occurs in about 10 to 30% of people who have suffered a concussion. It tends to be in the lower end of the range for younger individuals, so more like high school and college athletes, for example, and toward the higher range, toward the 30% for older individuals. So some of the symptoms, so there are cognitive, sleep, mood and behavioral, and physical symptoms associated with this syndrome. So cognitive could be like loss of concentration and focus and difficulty with memory. Sleep is an interesting one because often early on, the person is sleeping too much. And then as the condition progresses and we get further and further away from the concussion, the person might tend to have more trouble falling asleep as opposed to having too much sleep. In terms of mood and behavioral symptoms, it can lead to anxiety, depression, and irritability, or it could make those conditions worse if they are pre-existing. And then physical symptoms can involve all sorts of sensory dysfunctions. So things like ringing in the ears, blurry vision, noise and light sensitivity, potentially a decrease in taste or smell, but that one's pretty rare. And then more commonly, it also will cause headaches. Headaches can be part of this syndrome in and of itself, or it can be related to the injury itself that caused the concussion in the first place. So if you have whiplash or whatever type of neck injury, that could be causing muscle tension that could be leading to headaches. So it can be either or both that are causing the headaches. Can also involve neck pain, depending again on what was injured during the injury that caused the concussion. And it can include dizziness and fatigue. So risk factors for PCS. So first are demographics. As I already mentioned, age is a factor here. So younger individuals are going to be less prone to experiencing PCS, whereas older individuals are going to be more prone. Women are also more likely to be diagnosed with PCS. Now, it isn't clear whether that's because women are more likely to experience PCS, or if it's just that they're more likely to seek help and therefore get a diagnosis. So we don't know which one it is, but there is a higher incidence of PCS in women. Then another thing to consider is the nature of the injury itself that led to the concussion that led potentially to the PCS. So as I mentioned, the likelihood of PCS is not related to the severity of the concussion, but it can be more likely in the case of a very severe impact that caused the concussion. So a more severe impact doesn't necessarily mean a more severe concussion, which is the difference. That's the distinction I'm trying to make here. So a very severe impact, regardless of the severity of the concussion that resulted, is going to be more likely to lead to PCS than a less severe impact. Also, if the injury involved a double impact, it's more likely to cause PCS. And then if we look at how The experience of the concussion itself, so duration of the initial concussion symptoms can be predictive of PCS, and if there are major visual symptoms after the injury, that can be predictive of PCS. In addition, if somebody has poor neck strength to begin with, then that could lead to PCS also. Now, if we consider the person's medical history, so if they have a history of concussion, so they've had a concussion before the injury in question, then they'll be more prone to PCS. Also, if they had prolonged concussion recovery for that previous concussion, that's also a risk factor. Now, anything like anxiety, depression, or mood disorders is also a risk factor for PCS. So any existing mental health problems, including anxiety, depression, mood disorders, but also ADD, ADHD, learning disabilities, seizures, or migraines, any of those existing conditions are going to make that person more prone to developing PCS. So treatment. So as you can tell, there are many different risk factors. And so there are lots of different reasons that somebody might be experiencing PCS. And there are so many different symptoms. So everybody's treatment plan is going to look entirely different, just depending on what you are actually experiencing and why. So if it were me, if I wanted to be treated for my own PCS, I would probably start by seeking help from a neurologist or some type of concussion specialist. So they would do an exam and they would provide a diagnosis, and they would also be able to give some direction and design and kind of an overarching treatment plan. They would suggest other types of specialists to see and other types of therapies that you might be able to receive. And so those options could include things like physical therapy, psychiatry, psychological counseling, meditation, occupational therapy, neuropsychology, vision therapy, which is also commonly called oculomotor training or neuro-optometric rehab. You might also seek help from an ENT, an ear, nose, and throat doctor, an endocrinologist. You can go to cognitive rehabilitation therapy, or there are also medications that may help treat some of the symptoms. So what on this list is appropriate for the individual completely depends on what their total picture of symptoms looks like and what their risk factors were that kind of led to the development of PCS and those particular symptoms. So again, I would start with a concussion specialist of some kind and let them sort of guide your treatment plan. All right, finally, the pathophysiology here is very complex. And by that, I mean the physiology, the science of what is taking place in the body that leads to this syndrome. Now, it's not well understood, and the mechanisms are debated. So there's a lot of good research and a lot of good evidence to support what is actually taking place, but not everyone agrees, and it is definitely multifactorial. So there are definitely lots of different things that are taking place in this syndrome. So here I'm outlining a handful of these things. So first, the autonomic nervous system might experience damage during the injury that caused the concussion. So this damage would affect both the sympathetic and parasympathetic parts of the nervous system. So the fight or flight and the rest and digest parts of the nervous system. Specifically, white matter tracts between the cortical control centers and vagal nerve control via the spinal cord might be damaged. So I know that's a mouthful, and if you're not a physiological person, if you're not a student or someone who is very knowledgeable or learning about anatomy and physiology, then that's quite a mouthful. It might be difficult to understand. That's okay. Really, what we're saying here is that these superhighways that are connecting between the spinal cord and certain higher areas of the brain where a lot of our functions are regulated and processed, that can be damaged during the injury that caused the concussion. So part of what causes the syndrome is going to be that damage to those white matter tracts. Vagal nerve damage. So your vagus nerve, that is one of your cranial nerves, and it's carrying the majority of your parasympathetic output to your body, meaning that it's really important in the rest and digest part of your nervous system. So in the soothing, calming part of your nervous system. And so here in this picture, we see this little yellow thing, that's your vagus nerve. So it also can be damaged during the injury. And it's really important for controlling heart rate. It keeps your heart rate low. So vagal nerve damage can lead to heart rate variability, which causes a disproportionate increase in blood pressure and heart rate. So the vagus nerve keeps your heart rate low, keeps your blood pressure low. And if it's damaged, then you might have an increase in those functions, especially during exercise, which would cause early fatigue during exercise. So in this condition, we also will have difficulties with control of cerebral blood flow, in both directions. So too much blood flow and not enough blood flow. So we can have difficulty controlling our cerebral blood flow, blood pressure, and heart rate. So if we have a decrease in cerebral blood flow, that will tend to cause things like dizziness, headache, confusion, difficulty concentrating, fatigue, and lightheadedness. If we have the opposite problem, so an increase in cerebral blood flow, that can cause headache, vision changes, dizziness, and exercise intolerance. Okay, so again, if we look in our picture here, you see this is your internal carotid artery coming through here. So you can imagine that during the injury that caused the concussion, especially if it's neck related, that we could have some injury to those blood vessels, which could cause them to sort of close off and not provide enough blood flow to the brain, or it could cause them to not close off. It could cause them to expand and not be able to control how much they constrict or dilate, so how big or small they get. And so then that could mean that we have too much or too little blood flow causing all those symptoms. There also has been found in various studies to be structural and biochemical changes like atrophy and regional volume loss. Finally, there are psychogenic factors. So there are multiple theories related to the psychogenic factors that are part of this syndrome. So the symptoms of PCS are actually very similar to the cognitive deficits and the somaticization that are experienced in certain psychiatric disorders like depression, anxiety, and PTSD. And they also can be treated and are responsive to the same sorts of medications. So like, for example, there are certain cognitive deficits that are sometimes seen in conditions like anxiety and depression. And when given the correct medications to treat those conditions, those cognitive deficits are reversed. And because similar symptoms and similar medications also can help in the case of PCS, the same psychogenic factors are considered to be at play here. All right, thank you so much for watching this video, and I hope you have a great day.